the whole time.
Yes, it said that if you it said that if you disappear uh from view, it'll reset. Like you have to go through all the security measures again.
Oh, okay.
Um, but yeah,
Like, doesn't it measure like if how long you look away or look over?
you know what? It might. I've got the guidance. To be
Okay.
honest, I was like, I'm gonna read this again right before the test.
Yeah.
Um, so it might do that. I
Gotcha.
think you're right.
Well, and honestly, to sit and I'm saying this on the recording, to sit and cheat would not be easy to do because you'd have to look stuff up and then so
Yeah, and it locks down any other, like, if you leave it's kind of like some of the web-based CE opportunities where if you click off that current tab, like you can't like click off the current tab and have the recording continue.
uh
So you can't, you could minimize it or go to a different tab, but it would know that you're doing that and it would shut you down. So
so crazy. Again, AI can be a fantastic tool and can be a little scary. So we will see how that continues in our lives. All right. So we are on week 4. So after today, we will be halfway done. The reminder that I am on my old computer, so hopefully I can get through everything. We're going to be talking about the um, community assessment primer and then the capacity primer. Real quick, a little bit on the study guide. Again, the primers are going to be the thing that if I were you, I would focus on all the primers that they have in the different folders. So let's start off. Guess what's on the screen again? I know. We've never seen it before. But yes, the spiff. So when we're talking about all of these primers, as you read through them, you're going to say, oh my goodness, it's all the steps of the spiff. And it is. So the first one obviously is to assess the needs. That's where you collect data to figure out what the problem is. You look at what the resources are available. You look at readiness. Can anybody explain to me what readiness is? I think we talked about it last week, but that's going to be a big one too.
Is it like where the community, are they ready for the implementation of whatever we're trying to do?
Yeah, there's kind of several parts of it. Are they ready to say, yes, this is an issue we need to look at? Are they ready to actually do the work to do the work, do the intervention? And
Would
then
it be like,
go
I'm
ahead.
sorry,
No, go ahead.
would it be kind of like meeting them where they are, right?
Well, yeah, so that's why you would want to do a community needs assessment so that you can see, okay, and I'm kind of a geek. If nobody's ever been on the community toolbox, it is one of my favorite resources. And I always just Google community toolbox because it's kind of a funky website. But it on there, there's so much on there. But they have a list of things that if your community is in this stage of readiness, what can you do to help move them along that continuum? If they're in this stage, what can you do? So yes, you're absolutely right. So it's all about figuring out if they're ready, where they are, and then how can we move them further along that readiness scale. Also in the assessment, we're looking at just what are some of the basic demographics of our community. Part of that under the cultural competence piece is what kind of resources and interventions are we going to need later that's going to fit those different demographics of our community. So the assessment piece is really important. And I think back 20 years ago when I started in prevention and how we just jumped into the implement part, and gosh, the steps that we missed, and the just the things that we could have done so much better. So when we're looking at that, we want to define and describe the community, collect needs and resource data, conduct a problem analysis for each substance. So let's say you are looking at tobacco, alcohol, and marijuana. You would want to look at that problem for each, what the community looks like for each one of those substances. I know they say this personally, and from everything I have seen, you don't want to do like 3, 4, 5 different substances. 2 maybe, but 1 is really the best because that's a lot. Create a logic model for each substance. So a logic model is just simply a picture of how things are supposed to work. How do we go from what the need is to what we want? And then, of course, we're going to, because this is a circle and we come back around, you'll always want to update that community assessment as needed. And as you can also see, that needs pedal goes over that capacity pedal because we will be assessing the capacity of the community as well. All right, and please stop me. They use this term, community assessment work group. So I wanted to specifically put this up here. And it is on one of the pages that they said that they got a question from. Basically, all they're saying is if you've got a coalition, let's pretend like we're all in Montgomery County. They've got the world's most ginormous coalition. Let's say you've got a coalition of 300 people. You're going to have a community assessment work group. That's all they're saying, is that there's going to be a subset of whoever you have as kind of a work group that does community assessment. Their job is to collect, analyze, and report on the data. So don't let the wording kind of throw you. It's really just a subcommittee, maybe you might want to say. And of course, as we know, we should have people from a lot of different places be part of that. I could see a question that might say, all of the following should be included in your community assessment work group, except, and really that probably would be a bad question, but you might not need, no, but see, personally, I think it should be everyone, but something like that might be a question. You would also look at the evaluation process because the evaluation would be based on the assessment. So if you're assessing, tobacco in your community, your evaluation's got to be the same type of, look at the same type of data. And whatever data you base your findings on needs to be data that you're going to be able to look at again in a year, 2 years, whatever that might be. The work group also reports to the community. It's one of the entities that kind of gets the community involved and builds that readiness and the excitement around whatever it is. And also kind of picks here specifically what we're looking at. So you guys know what a community assessment is. And when they throw in that word work group, sometimes I think it kind of throws people. So I just wanted to kind of throw that out there like that. Does that make sense? Okay. This is a big graphic. And I wanted to specifically pull it out because this is on page 41 of this community assessment primer. And we're going to go through every part of this. So this is a lovely tree. It is basically showing how we can do that assessment and drill down to what the root cause, the risk factors might be that we would want to then base our interventions on. So looking specifically at the top of the tree here, let's say you do an assessment and these things here in the leaves are what you find out. You see that there's been some poor school performance. There's been some discipline cases that have to do with alcohol. Let's say there's been some DUI cases. And 19% of them, which is a big chunk, a fifth of them has to do with minors. Let's say that we are seeing a lot of sexual activity in teen pregnancy, a lot of youth violence that has to do with alcohol. So when you see all that data, and again, let's just say you're sitting around a table and these are the pieces of data that come in, you look at it all and go, you know, the one thing I kind of see that draws all that together would be what? What's something that kind of draws all of that to a similar place?
Alcohol?
Yeah. And if you see on our trunk here, it says underage drinking. So we're looking at all of this and we're like, okay, drinking. And in particular, for all of these things, we're looking at minor drinking. So that's kind of our trunk. So we got all of our data coming together to the trunk. Then if we specifically say, okay, now let's specifically look at underage drinking. So some of the data they see there would be, you know, the 58% of 12th graders drank alcohol in the last 30 days, or they've got the 21% of 10th graders were binge drinking in the last 30 days. 27% of 6th graders have tried alcohol. Those are some of the data. Then once you figure out what your kind of trunk issue is, then you can see what are some of the things that relate to that. Does above the ground make sense so far? Okay. So you might then say that our problem statement is drinking, underage drinking is a problem in X county as evidenced by 58% of the 12th graders reporting having had alcohol in the last 30 days, in contrast to the national average of 16% and the state average of 30%. It's always nice to kind of, you know, give those comparisons, because some people might say, well, 58%, isn't that like normal? But obviously we see it isn't. So as you can see for this one, we took one of these three things down here at the bottom and made it as part of that statement. Imagine if we took the 6th grader one, totally different kind of statement, right? All still the same underage drinking trunk. All right, so now we've got the idea or the problem statement that we're going to use. Now we need to look at what are some of the root causes that is creating this. So they may include people in stores who are like, I'm not going to card. I don't want a card. You know, and my husband and I were talking about this morning. Kids know which stores those are too. Maybe it's that bars are accepting fake IDs. I know no bars around colleges would do that, but if that were to happen, that could be something. Maybe people are saying that they're getting it from their friends, older friends buying stuff. Maybe it's just general availability. You know, there's always the comment of beer refrigerators in garages. And you know, like in the South, we would have carports or whatever, and everything would be open and people could just go and grab beer. That's availability, right? Maybe it's parental approval. So, you know, parents saying, you know what, I'd rather them drink at home, so I'm just going to go ahead and give them beer. Maybe it's the perception of harm. So it's not really a big deal to drink. Everyone drinks, so what's the big deal? Maybe it's supervised use, whether or not, you know, the kids are using at home. Or maybe it's just that the whole community's like, you know what, teens are going to be teens, they're going to drink, what's the big deal? So drilling down then to these root causes is going to help us when we look at what kind of interventions are going to actually get to what we want. So let's say that we're going to use this one, that we believe supervised use will prevent DUIs. Or that families believe that, I should say. So we've got our problem statement, same one we had before. And then the question is, why is that happening here? So we say, well, it's happening because 84% of the parents believe that supervised use of alcohol by teens will prevent a DUI. So we've got the problem statement. And then we've got but why? That's those root causes. Why is it happening? Then the next question is, but why here? Why is it happening in Springfield, Ohio, and not in, somewhere else? That then comes to but why here? And again, this can be so many different things. We're saying that X county parents lack the knowledge to make healthy decisions with their teens about alcohol use. So I want you to think about, let's go back and say that, no, stop. We have the same problem statement, but we choose a different but why. Maybe we choose the availability, or we choose the merchant's carding. You can imagine then that our but why here would be so different, and then our interventions would be so different. So there's going to be questions on the test that are going to say, here's your root cause. Which one of these would be an intervention that would match it? All of them could be fantastic interventions. But for this, like for this one that we chose here, that parents lack knowledge, what would be a good intervention that would match that?
Parenting education.
Mm-hmm.
We created something called Safe Homes in our county, in Montgomery County, and it's actually about helping parents to talk to their young people and understanding basics of multiple different drugs specifically. Yeah. So.
And that would absolutely match this, but why here? But you can imagine if we picked a different one, but then put the parenting education in, it wouldn't match. It's still a fantastic thing, but if we chose 1 in 5 merchants are not carding, but then said we're going to do this parent education, it doesn't match. It's great, but it doesn't match. So I think we had talked a couple weeks ago about the question where it said which one of these activities would fit the risk factor. This is kind of how you really burrow down and figure out what's the risk factor and what would fit that. So what would be an intervention, let's say, if we chose 1 in 5 merchants not carding?
I would say education to merchants, but also to parents, and education to maybe the community as far as the law enforcement spot checking, or even signage, that says we card everybody. And then that could maybe take some of the pressure off of the ones who are not carding, that we just card everybody. So
yeah, I would focus more on the educating the merchants. Signage would be great. Even letting these are the things that as a prevention specialist you talk with your family about in your free time. We were talking about this morning, and the actual person who serves or the person who sells us who gets in trouble. So making sure that the store owner knows, you're putting your employees at risk by not letting them know about all this information. So again, goes back to the same problem statement, same trunk, but totally different root. So there's going to be questions that are going to ask you to match those up. Just make sure you really look at what's the root cause and what would be an intervention that would meet that root cause. Questions on that? Does that make sense? Okay. Because I know they love this little this lovely tree here. Let's get back to. They love this tree. So I don't know if there'll be the tree on the test, but there will at least be this information in this way of looking at it. Because it was one of the ones that they chose. All right. I just wanted to specifically pull this chart out of the primer because I think sometimes the wording and for those of us who may have started like on the treatment side of things and then moved over, sometimes the wording is a little funky. So if they use a word like data, it might also be information, measure, indicator, data point. If they use that term root cause, then we're looking at what is the risk and protective factor, what might be a resiliency factor, contributing factor. It's those things that are down in the ground, which is why we call it root cause. Objective, objective, goal, outcome is all very confusing to me. And or not confusing to me, but it's way too convoluted. So if something happens and you don't figure that out, it's going to be like one question. Don't stress too much about that because I don't like the way that they mix those together. And then strategy. Your strategy might be a program. It might be an initiative. It might be a policy change. I know sometimes those of us who do very one-on-one or face-to-face direct service work think strategy and only think program. But remember, strategy can also be, we're going to work on implementing this policy. Or our strategy might be, we're going to look at creating a coalition. That might be your strategy. So just remember that strategy is a broad term. Yeah.
I just wanted to kind of point out I know in our primer, it talks about how words matter and sometimes it's based on the funder. And just as a quick example of that, one of the applications that we just completed, you were allowed to say that you were going to attend training, but you couldn't say you were going to attend a conference. And so that was the difference. I mean, how crazy is, a training and a conference? It's like, well, I guess you could really, say, well, conference maybe is assumed
Multiple
longer
trainings.
than a training, right? Or something. But I thought that was quite interesting that as long as you said training and not conference, you were allowed to
That is
claim that
interesting.
on the budget. So yeah, so those are, some of the ways of those words being kind of interchanged, but sometimes it does matter based on the funder or the process. So pretty silly, but I thought it was an interesting example when I was reading this last night. So
It is. It is. Yeah, it's and you don't want to necessarily do focus groups because sometimes there's a lot of legality that goes around that, but you can do a listening session. It's a listening session. That's all we're doing. All right, so just look through this, kind of free your mind and the rest will follow. I'm not going to sing it, I promise. But just see how this can kind of match up. Because if they say something like measure, know that they mean data. All right, we're back to the spiff again. Now we're looking at the capacity piece. Remember that this lovely petal, they do overlap. So we're going to be doing some capacity while we're doing assessment. And some of the assessment is going to be of the capacity. But when we're talking about capacity, we're talking about mobilizing the and building up the community. Trying to move all this stuff around here. So that we can have capacity of who the people are and what we have there. What are some things that you might notice in capacity? Like what might fit under that category? Go ahead.
No, I was just noticing that it doesn't really talk about, it's mainly talking about people resources as opposed to financial resources?
The reason
Building
is because
relationships.
this is a CADCA primer. So it's all very focused on coalition work. But you're 100% right that financial resources would be one. Geographic resources. So if your county is really huge and there's not a lot of transportation or it's difficult to get to places, that is dealing with capacity. Again, that would be kind of assessing the capacity. Do know though that everything that's in these CADCA books is very skewed towards coalitions.
I would think even what you mentioned about how you want to be able to use the same thing you assess in your evaluation, and capacity, I think in some ways could also be impacted there too, or you need to look at that like, okay, so if I capture this right now and I use this as my evidence of the problem, or thing and I can't, you need to make sure that you have the capacity to follow up with that again. Like, is there going to be a way to get that same information the next time? If you used a one-time data gathering survey, how am I going to go back to that later? So, just capacity has to really across everything.
Yeah, great point. Great point. Yes. Yeah. Capacities like your personal internal capacity. Do I have the time? Do I have the resources? Do I have the strength, the people to do it? It can be groups. We assess that we have a large Spanish speaking population, but we do not have anybody who is bilingual and speaks Spanish in our group. So that's a capacity issue. And then it can be, do we want to build a coalition? What they talk about with capacity is building the coalition membership, developing the structure, cultivating leadership, and then identifying what training needs might happen. Again, training, not conference, right? It is crazy, those little things. All right, so we have gone over this. I'm not going to go over it again, but it comes up a lot in the CADCA primers. So I would not say you have to memorize all the different sectors, but understanding that there are vast numbers of sectors, 12, that we need to try to get people from. So just understanding that we want to have a very diverse group. If you had a coalition with 2 people from a prevention agency, 2 people from a treatment agency, and then a counseling agency, your capacity is going to be very limited. So that's kind of where that comes in on this part. The more sectors you're able to pull in increases your capacity of what you can do. So I thought this was an interesting chart, so I wanted to bring this to you guys. They talk about the difference between coalition members, so those people from the different sectors that come together, as opposed to staff. So when money comes down for a coalition, there's an agency that is the fiscal manager. They don't own the coalition, it's owned by the community, but they own the money. And they're generally the people who maybe pay 1 or 2 staff people to run the coalition. Different from a member who might be a police officer from the police department, or might be a city council person that has come into the coalition, or a business owner that's come in. They're I don't want to say volunteer because usually they'll get paid through their agency, but they're coming together for the good of the coalition and the purpose. Questions on this, on the test may be something like, what would be the role of a staff person as opposed to a member? And really the main difference is that staff are usually the runners and the facilitators of the group, but they're not the owners. Does that make sense? So we've got our structure. We've got our coalition in our little capacity that we're building up. Next, we need to look at what's the training needs, because in capacity, let's just say all of us here are a coalition, and we might say, you know, we looked at our root cause and we know that the laws around stores carding young people is going to be something that's important to us. Do we all know about that? Well, maybe there's some of us that are like, I have no clue about what that law means. So we need to be able to educate everyone in whatever our root cause is. So when they talk about what are some of the things that you can do, they ask, you know, how do we, oh, stop moving. How do we make sure that everyone is functioning smoothly? So do we have the people, and that's where we might do an assessment of our coalition and say, who knows how to do A, B, and C? So that we know what our skills are that we already have. So that's assessing our current capacity. And what kind of capacity do we need? We need to think about what is our readiness to get things going. So, you know, you guys all chose to be in this study group because you're ready to get ready and take the test, right? So your excitement and engagement is going to be higher than if I just pulled some other people in and said, hey, let's study for this test that you know nothing or care nothing about. Meetings efficient and task oriented. Again, this is usually, not always, but usually a role for those staff members to make sure that the meetings go efficiently and task oriented. So that could be, how could you assess that? How could you ensure that's happening?
Could do post-meeting surveys.
Yeah. And there's lots of ways you can do that. It could be like an exit ticket. I don't know if you guys have ever heard of that, but like at the end of something, you know, write down one thing that went well, one thing that you would do differently, and one thing you want for the next meeting. Or you could send out a survey. But making sure that we're assessing that piece of the capacity is important. Do people feel like it's okay to talk during the meetings? And are we maintaining that, you know, that openness to talk and that decorum? Again, could be that you're just doing some observation, could be that post-meeting survey. Is everyone doing a little bit? Now this to me is probably one of the biggest ones, because you don't want it all to rely on the staff members. It's hard. It's really hard, but making sure that everyone in the group has a piece of it. Why does it matter if everyone's doing work? If it gets done, why don't just have the staff members do it?
It's lack
I
of
think it goes
accountability,
back to the
buy-in.
nothing about, oh,
I'm sorry.
go ahead. Sorry, Laura.
Oh, it's okay. I was just saying it's a lack of accountability or buy-in, or could promote burnout.
Okay. Yeah.
It's just letting you know that everybody is equally invested in this.
Yeah. Anna?
And I'll add the exterior, or sorry, my voice is going. The outside perspective, I suppose. The idea of actually making the nothing about us without us visible.
Yeah.
Because if it's me and one other staff person going to Oregon State, which I have loved to visit but have never lived in, and people are like, "Who's this Anna girl doing all this work?" Yeah, it makes it seem that even if this Anna girl is heading something up, that the community is rallying around the cause and she's just pushing buttons and letting other people do the work. It's everybody together.
Right. It's everything you guys both said. So making sure that everyone has buy-in, no one is doing everything and getting burned out, that we are getting those unique perspectives from other people. You know, it may be, there's lots of different ways someone can participate in a coalition. It doesn't mean that they have to run everything. You know, maybe your police officer may be very, very busy, but being someone who's always there and talking about what needs to be done from his perspective or her perspective can be very valuable. So there may be different ways of participating, but making sure that everyone has some way to efficiently participate. Heather, were you going to say something? Sorry.
No, it's just, it's interesting that you bring this up because I'm currently a member of a coalition, it's a suicide prevention coalition. And I just had this conversation that I really don't feel like I'm valued or needed at that meeting because the coalition coordinator
Mhm.
basically just talks and talks and talks and talks and talks. And there's no opportunity for me as a member with my own sort of perspective and expertise to contribute in those meetings. And so I really don't feel like I even need to go.
Yeah.
And so I think it really, if people show up, it's because they have something they want to contribute. And so when the staff monopolize meetings and do everything, then people start to disengage.
Yeah. You're 100%. Thank you for sharing that, because that is one of those pieces that we think, oh, well, we don't want to put a burden on someone, or, you know, we're getting paid for this, they're coming as volunteer. We don't want to, like Heather said, if they're there because they want to be there and they want to do something. So that's very important to monopolize on that, because otherwise that's that readiness that's up here, and that readiness is going to go if we're not able to cultivate and maintain it. And there will be maybe not questions directly about that, but there will be questions that will talk about, you know, how do we keep everyone involved in the coalition? So leaders keeping everything on track. Is the meeting one that is respectful of the diversity? It's making sure that if there is conflict, things are dealt with appropriately. All of this has to do with, you know, are we running our meetings properly? And then the next question would be, how strong are our coalition's external connections with the community? What do you think that means?
To me, that speaks to a little bit of the membership and the public perception of the membership. Like, do these people actually have good connections in the community, or are they looking at it like, those are all terrible people and they don't listen to us, you know?
Mm-hmm. Yeah.
Yeah, I think also the different sectors within the community as well, the relationship we have with the police department, the relationship we have with other agencies, thinking of treatment and recovery houses, all of those things that we want represented, and how we are viewed in their eyes.
Yeah. Any other thoughts?
I'm just going to add to it. I went to a training, probably actual training at OSU about 6 or 7 months ago. And one thing that they had bilingual counselors there that work with certain communities. And the thing that they found out, they said USA means you start again, because they were saying that when they come here, regardless of the credentials or the experience or the education that they had to start all over again. And not including the people who held positions in those communities that were of high esteem with those communities in the development of programs or in the development of even how to help people who have come over to the country. It was disheartening. So I found that something I never forgot, is that USA stood for You Start Again for those communities. So just putting people in those conversations, or that actually hold clout in that community, whether it's a grandmother, whether it's someone who doesn't speak English, you know, that to find out how they can communicate better than us with the community that we want to serve. So
yeah, absolutely. Interesting. Never heard it that way. That's cool. The other question is, does our community even know that the coalition exists? You know, this is not something we're good at. We're not good at tooting our own horn, but making sure that the community knows, hey, this is the good work we're doing, and this is how we are making an impact in the community will strengthen those connections, and also will help build up that readiness in the community. So, do we have strategies in place to get information out to everyone? Are we able to identify and bring in additional people? So those kind of work together. If people don't know about us, then how are we going to be able to get people in? And then, does your coalition make sure that proposed community strategies are culturally competent? You know, are we making sure, like Laura mentioned, that, you know, if we need a Spanish speaking counselor, we have one? Or are we just saying, well, you know, everyone can speak a little English? That's not how this works. So these questions and these ways of looking at the capacity of a coalition are gonna be some way on the test. So that's why I went through each one to make sure that we understood what that meant. Does that make sense? Any part of that doesn't? All right, we're gonna watch a video, and this video is from Ohio. It's kind of cool. But we're gonna don't worry about like taking notes or anything. Just watch it, because we're gonna go through each one of the pieces. Now let me make sure that I am sharing my sound. So it'd be good if you could hear it. Oh, stop it. Hold on. I didn't bring my my good mouse with me, so I'm using the touchpad, which is sometimes share sound. There we go. All right. So it's not a real long video. Just watch it
now. Southern Ohio's Scioto County became the epicenter of a nation's growing opioid crisis in the early 2000s. Scioto County attained the highest opioid prescription rate in the state. More than 9.5 million painkiller doses were dispensed in 2010, or more than 120 pills per citizen. The Ohio Department of Public Health brought together Scioto County officials, health departments, and other sector representatives affected by the opioid epidemic to develop a solution for this problem. 2 county health departments encouraged partnerships among local stakeholders, leading to the formation of a community coalition focused on both curtailing the current crisis and preventing youth initiation into non-medical opioid use. The newly formed Scioto County Drug Action Team Alliance participated in CADCA's National Coalition Academy training, where coalition leaders learned about local data collection, collaborative planning, and the development of comprehensive strategies to address substance misuse. Framed by the 7 strategies for community change, the coalition's activities targeted individuals as well as the whole community.
In our county, we can actually see live how many people have presented to the emergency department on a drug-related issue, and that helps us to identify, you know, if we're having a spike in overdoses and if we're seeing improvements and things like that. We recruited within our school systems a person in each school system that would be that youth-led prevention leader in that school system. We really expanded access to naloxone, and I feel pretty good about that, because naloxone is really just sort of a household word, you know, very, very normal in our county, and people aren't afraid to use it. We began to expand our addiction treatment facilities. We definitely ramped up access to medication-assisted treatment. We got new providers. We've done trainings with new providers so that we could expand that workforce. And we also began to really expand our prevention. We were also able to get it to the law changed to where you didn't have to be a physician to hand that naloxone to someone. Now anyone can do that as long as you're trained. So that helped a lot. It wasn't necessarily feasible to expect a doctor to go with you every place to these outreach events. So we have that change now. We were actually the first county in the nation to declare a public health emergency over prescription opioids. And at the time, that seemed a little odd, certainly based on the phone calls I got from all over the Associated Press and everybody calling. But, you know, now here we are 8 years later, and we have a national public health emergency related to prescription opioids. So we were just really kind of the canaries in the coal mine in Appalachia in terms of the devastating effects of these drugs. Well, the thing that I learned at the National Academy and the strategies that we learned and the tools that we made there really kind of helped me to hone in on specific data that and think very strategically about how to address that problem. Looking at root causes in the community, looking at the big picture. We've had reductions in past 30-day use of alcohol, marijuana, tobacco, and the largest decrease we had was in the non-medical use of prescription drugs. We also had reductions across the board in all of the other categories of drugs. And so, we feel like we really did a good job with our youth. Our adolescent prescription, non-medical use of prescription drug rates are actually below the national average. Our prescription drug-related fatalities have declined. We have also seen our hepatitis C rates decline, and we comprehensively address all of those things through other avenues. In coalitions, you're not dealing with just this person or just this set of people. You're dealing with the environment, the entire environment where these people live and how they interact.
There we go. All right. So, had anybody ever seen that before? I think it was kind of cool that it's an Ohio one. All right. So she specifically talked about the 7 strategies for community change that were put out through CADCA. So let's look at each one of those. Come on. Each one of those, I screenshot each one. So we're going to go through each one. So the first was to provide information. They collected their data. They looked at what that use looked like. So this is their assessment part. And they also, talked with the local health department. It's just getting that data together. So that was the first strategy. Then they looked at how are we going to enhance skills. They did the countywide educational initiative called Start Talking. So that's enhancing skills. They wanted the youth-led prevention initiatives, enhancing those skills of those young people. The annual youth-led training prevention training, and then the workplace trainings that they would do. All of these are ways that they enhanced skills. Next was providing support. They piloted Ohio's first community-based naloxone education and distribution program. So support to people who might be in active use. They conducted a countywide educational campaign on overdose prevention, recognition, and response. So again, providing that support to some people who might be in use, and we're training those first responders. So providing support to the first responders. Strategy 4 was enhance access or reduce barriers. So to enhance the access to addiction treatment facilities, they expanded them and also increased the medication assisted treatment. So enhancing the access there. Acquired and trained new providers, enhancing access there. And then they did some activities that she didn't really talk about what, but amplifying their prevention efforts. So made it so it was easier for people to access those prevention efforts. Changing consequences. They had 2 pieces of legislation that allowed for regular citizens to be able to carry that. So previously, if somebody who was a regular citizen had naloxone, you might have had some kind of consequences. They changed that so that anybody could carry that. And let's see. Yeah, so you weren't at fear of arrest if you had it. Physical design, this is a little different than some of the other physical designs we've done. This is you might call this a metaphysical design. They received the designation of a high intensity drug trafficking area, which that in and of itself can open you up to so many other opportunities. And then finally, they modified or changed policies. They sent their CADCA leader or their coalition leaders to CADCA. They learned how to do things from like the public health arena or prescription monitoring arena, figured out how more of those strategies can be put into place. So I just wanted to kind of go through that video so that you could see those different strategies in a different way. Questions on any of that? I will say that I know the test questions sometimes can be tricky. It's not going to be so tricky as they're going to say, if someone did this, would it be, they're not going to say, is it a modifying or changing a policy or changing consequences? Because there's a lot that can be overlap between those two. But they might say, is this providing information, enhancing skills, modifying or changing a policy, or changing physical design? Those would be ones that would be a little easier to differentiate. I would make sure that you know those 7 strategies too. All right, so just to confuse life a little bit more, they've got 7 steps for program planning. So this would be, if we're looking at in the capacity assessment capacity piece, we're looking at creating that logic model. What are the 7 steps to actually get into? So this is kind of a subset of 7 steps. So, and it's all the things that we're doing that you guys talked about doing. It's just they put it into this 7-step process. Assessing the readiness to make sure that your community knows what's going on, that you know where they are in readiness, and you're able to help to try to move them along. Looking at those risk and protective factors, and then translating that into priorities. You may have 5 risk factors, but I don't know that any of us are so good we can attack all 5 at the same time. So, picking a priority. Examining resources in the community. So what are some of the things that we might be able to use? And this goes back to that capacity piece of, are there places where we could get funding? Those people who are in the Hamilton County area, P&G is a huge funder. What can we do to kind of mobilize that? If you are, I didn't grow up in Ohio, so what I say may not translate well, but let's say you're in the Cleveland area. The Cleveland Browns, do they have grant money that they would want to put into the community? I always talk about, I think I told you guys, the largest YMCA in the country is in Warren County. If people in Warren County aren't accessing that capacity piece, that resource, that could be a problem. So make sure that you're examining all the resources in the community, selecting a target population. Again, we would love to say we are going to help every single person in the entire community, but we are not able to do that. So, you know, are we going to try to impact 13 to 16-year-olds dealing with alcohol use, whatever, but getting specific, applying best practices and guiding principles. So making sure that we are not just doing what feels right, but what actually has some science behind it. And then we've got to evaluate. If we're not evaluating things, we don't know if what we did anything. So don't know that I would say memorize these steps, but just know that these are all the kinds of things that need to go into that assessment capacity planning part of the SPIF. Questions on any of that? All right, what is archival indicators or archival data? What is that? Anybody know?
Is that looking at like longitudinal data that's been collected over time that you have available to you? Either local, national, state, whatever.
That's part of it. It doesn't
But
have to be
tracking that
longitudinal. It doesn't
Right.
have to be longitudinal. It just has to be data that was collected before.
Gotcha.
So any points of data that were collected before. So if you are, let's say you are looking at your community and you want to look at some data from the hospital on rates of young people coming in for, excuse me, for alcohol problems. That would be archival data because we're looking at what happened in the past. Now, if we're then going into the hospital and doing a survey, that's something we are actually doing now, so that's not archival. Can you think of any other archival data? Things that might be considered archival? Excuse me.
I would say maybe archival data would probably be like when I work with different coalitions here, it would be like for overdose deaths for the coroner's office. Like we do overdose deaths, and then we'll look at where it was in 2021 or 2022. So we look and see where it is in this community in 2023. So we take those old and see how it's changed or demographics have changed.
Yeah.
So we do a lot with that.
Yeah, absolutely. All right, I'll just show you guys the list. What's the availability been like in the past? What are some of the laws or norms that have happened in the past that maybe are changed now? We know that, like looking at the dates for when tobacco being sold at 18 occurred, the sales numbers under that, how many people under age of 18 were caught with cigarettes versus now that it's T21. So doing a comparison of those could be archival data. What's the transition or mobility of the community? Do we have a large population of people immigrating in or people moving through this community? Or is this a community where it's mostly just people live here all their lives and there's not a lot of mobility? So looking at those past indicators about that. Looking at, has the community in the past had that attachment to the community, or people just kind of live here and don't really care? And what would be the indicators of that? Maybe times that there's been extreme economic or social deprivation. You know, when AK Steel pulled out of Middletown. That was a big issue that happened and a big extreme economic deprivation. So looking at the data then and then looking at it now. Maybe looking at what were some of the family management problems that may have happened in the past, conflict, maybe what are some of the parental attitudes that maybe we collected in the past, and then, so that would be archival, and then maybe we do a survey now to see what they are. That would be recent data. And then you match those up and say, okay, where are we? Have we moved the needle at all? Looking at whether or not people are committed to the schools in the community, or if there's, there's been a lot of people who don't, maybe they don't vote on levy laws, or there's maybe there is a lot of people who go to the school board meetings, that kind of thing. Early and persistent antisocial behavior. So how could you find that out in archival data? What might be something?
Talk to your juvenile justice
Mhm.
center and ask for their data. They keep a lot.
Which is why it would be great to have somebody from there on your coalition, right? Super easy. So yeah, looking at truancy rates, looking at violence, looking at all kinds of different data indicators from the past. Academic failure, if it's in that early time period. So again, let's see what it was like in the 80s, 90s, aughts, teens, and now. Alienation and rebelliousness. What do you think that might be? The weird one, isn't it?
I know that Children's Services used to have a thing called, oh gosh, just went out of my head, status offender for young people. That was something that was kind of considered that unruly behavior. This is Pennsylvania, sorry. But it was things that weren't necessarily criminal, but things like curfew violations and running away from home and things like that. So kind of an opportunity maybe to even check something like that out, like how many status offender young people were charged with, or found dependent as a result of status offender.
Yeah, exactly. So looking at what it was like then. Go ahead.
Jennifer, just a quick question. When you put pages on here, I try to follow along.
Yeah.
How is suicide death rates by age, suicide thoughts, planning, and attempts by gender and grade? How does that fall under alienation and rebelliousness? Or will I even need to know that at this point?
Well, you wouldn't need to know that.
Okay.
I struggle. We know that looking at deaths by suicide, the wording and the way that we categorize it has changed so much just in the last 5 years.
Correct. Yeah. Okay.
And I struggle because I think sometimes they're a little behind because,
Right.
it takes a while to publish things.
So if we're thinking like 10 years ago, I could see how that would be alienation.
Yeah.
Okay.
Yeah.
Thank
And
you.
it's about when these new ones were written up. So
Gotcha.
yeah. Friends who engage in risk behavior. So, we know that peer involvement in risky behavior is going to increase. So what were people saying their friends were doing? And then maybe we could do a survey now, which would not be archival, to see if there's been changes. Favorable attitudes. So, hey, it's cool to do that. Or, we've seen a lot of changes with favorable attitudes towards marijuana because of the changes in laws. So looking at the archival data before the laws changed and looking at it now could be an interesting data deep dive, as they say. And then how early is the problem behavior initiated. So, maybe in the 80s it was 14, maybe in the aughts it was 13, and now it's 12. Looking at that and seeing some of the other things that go around it can be those archival indicators that might tell us either what we're doing great, what we need to still focus on, whatever that might be.
Our juvenile court does a very good job of doing an annual report every year. And that is one of the things that when I was doing another program, we would look back at that and see what the youngest age of young people, and it was very kind of alarming at some points, because there were kids as young as 8 years old that weren't being charged criminally. But because of their age being under 10, but so that's I think a really good way of looking is going back to some of that kind of archival data, comparing different years, and that's it was really frightening to see that. I haven't looked at them for a while, but that was something that that really gave a good indicator from that report.
So, and this isn't just for you, this is for anybody. How could knowing the age of first use or first problem behavior impact prevention efforts?
You said the age of first use.
Mm-hmm.
It tells the environment that they're in. It tells family life. It tells how their brains have been affected. It tells a lot
How
of
could that
things.
change what you might do?
How did it change? I think it'd do my research a little. It would make my approach and research a little different. A lot different.
Okay.
Taking all those things into consideration when you design a program for someone like that or a group like that.
Yeah.
It has to meet the need, but starting where they are, not where I think they should be.
Okay.
Yeah, I think it would shift it from more of a universal or selective approach to an indicated approach.
Okay.
I think it could also change the time frame where we're starting those prevention programs. Maybe we were targeting like a 5th, 6th grade, where now, I know personally I am, I'm in the kindergarten, when we're in elementary, we've had to do, opioid prevention in their 2nd grade.
Yeah.
We have vaping, a 2nd grader brings a vape to school. So I think that changes where we have to target those programs.
Yeah. And I think that from a prevention perspective, we realize that, some people might say, well, if they're not using until 10-year-olds, then that's where we need to start our prevention efforts. But no, we need to back up and do it before that. So yeah, knowing that age of initiation of problem behavior is definitely going to impact where we reach, where we impact those young people. And yeah, I did yummies and yuckies with Head Start kids, things that are okay to put in your mouth and things that are not okay. And yeah, big way of looking at how are we going to use that archival data to change our approach or change the way we do things. So I would say for test, just know that, archival data can be a lot of things. Not to pick on you, Heather, but I'm going to, when you said longitudinal, yeah, that's one piece of it, but it's not the only piece. There could be so many other things. So just knowing that it's really anything that's happened before us. All right, you want to do some practice questions? I know everyone's so excited about practice questions. All right. A needs assessment that uses information collected from interviews, focus groups, and or observations involving document reviews to produce a descriptive report is called. So what do we see in this question before we even look at what are the possible answers? What kind of things do you see in this?
The lack of discussion of like surveys or quantitative data. It's really focused on qualitative data.
Okay. the same for everyone? As if you, go ahead, Stacy.
That's it.
Because if you look, we're talking about interviews, focus groups, observations. Yeah, these
I
are,
think
go
I
ahead.
think there's some opportunity for being a little bit subjective. There's nothing that's an actual quantifiable kind of a process with that data. It's
Okay.
not a figure like Heather was referring to. It's not a here's a percentage or an eval, that kind of thing. It's so kind of subjective about, probably what I'm assuming is like quality of program or the way the program was looking and how did it do and things versus the actual outcome number.
Yeah. So if you were to read this question and say, oh my gosh, it's a descriptive report. What is that descriptive report called? If you didn't really analyze the question, you might be like, I don't know what the descriptive report is called. There could be all kinds of things. Now we're going to look at, now that we've kind of analyzed that question, let's look at what the options are. We've got qualitative data, outcome data, quantitative data, or indicator data. Now, just what we looked at, are there any that you could just eliminate?
Quantitative
Yeah, quantitative and outcome.
outcome.
Okay.
Indicator.
Tell me, go ahead. You were saying you would eliminate indicator?
Oh, I thought somebody else said it at the same time I did. Yes, I would eliminate indicator because I don't think it would be a good way of saying that that's exactly what indicates that, what our problem is. So.
And you guys figured it out before we even saw all the answers, that this is qualitative data. So don't freak out when you first read the question. Again, sometimes it's nice to cover up the answers and just analyze what the question is asking, because you guys had the answer before we even looked at what the options were. All right. The most important feature in creating a logic model is, what is a logic model?
It's that plan that lays out where you start, where you want to get to, and the activities that will take you from where you are to where you want to be, and also identifies how you're going to know if you get there.
Okay. That was an A+ answer there.
That's what I was going for.
Okay, so key things that she said, where we are, where we want to go, and how we're going to get there, right? So let's look at our answers and see which one kind of fits that. That would be the most important feature. We know that there are things in a logic model. There's going to be information about probably budgets. There's probably going to be timeline things, right? But is that the most important feature? Because remember that you got to look at what they ask. They're going to do a lot of things like most or best. So is the most important feature of a logic model trying out multiple strategies, enhancing community involvement, helping you determine appropriate staffing patterns, or connecting your outcomes and your goals?
D, connecting your outcomes and your goals.
Yeah, exactly. Can it enhance community involvement? Yeah, but that's not the purpose of a logic model. It might have information in it that will show you how to do that, but that's not the feature of a logic model. Might it help you develop and figure out how many staff you need? Because you're going to say, we're going to do 15 life skills classes, so I know I need 15 instructors. Yeah, but that's not the most important feature. Does this one make sense? Okay. This is a seemingly easy, but kind of tricky question. So archival data, we just talked about archival data. So we know what it is. Let's look at the options. Information from a large number of individuals, agency compiled information, hard to find, collected from surveys. So let's go through each one of these. Information from a large number of individuals. Is that always what archival data is? No, not
No, it can be
necessarily.
included, but it's not it. Mhm.
Right. Is it information that your agency pulls together?
Yes.
Kind of, yeah.
Yes.
Okay.
Yeah.
Is it hard to find?
Sometimes.
But is it always hard to find?
No, not at all. Not at
Okay.
all.
So again, it could be to some of it, but not to everything. Is it collected from surveys?
Sometimes.
Sometimes. Yep.
Sometimes, but not always.
Not always.
So which one of these is something that's almost always what archival data is?
B.
Compiled information.
Yeah, it's just stuff that we pulled together.
Mhm.
I know it's a little funky question, but I've seen this sample question a lot.
I don't like that question.
Well, I'm sorry, you don't get to pick and choose your questions. I think, and there's gonna be several types of questions where you have to say, they love those questions where is archival data information from a large number of individuals? Sometimes, but not always.
Right.
Is it hard to find? Sometimes, but not always. Is it collected from surveys? Yeah, but not always. So I think that that's something we have to, when we're taking the test, we have to really think about it, specifically what we're looking at as a full and complete answer. So Heather, when you get on there, just tell the AI you don't want that question, okay? Yeah. All right. So next week, we're moving around the SPIF flower. We're doing the planning, implementation, and evaluation. I'm going to show you a few things. I am going to already started building my email to you guys. Have I shown you CRAM? I have so many I never know what I showed to anybody. So CRAM, C-R-A-M, kind of like cramming for a test, is a online flashcard, basically. And you can do an app with it as well. But my suggestion is to go into CRAM, if you like this kind of thing, put in CADCA, C-A-D-C-A. I have put all of the glossaries from all of the CADCA primers in here. So I will say it's a free website, so there's lots of ads. So just beware of that. But once you put in CADCA, you can see glossaries. You can also see other people have put stuff. Obviously, use everything that you feel would be important for you. I wanted to do each glossary separately because that only makes it like 37 flashcards. This one's 276, which is a lot. But what you can do, and you can do this on the app as well, is you can go in and you can just do simple flashcards. Like it will show you one side, the name, and then the definition on the other side. So I will tell you, it's with Zoom up, it's a very slow website. They also have a way where you can test using it, which is kind of cool. So you can do it as a matching, you can do it multiple choice, you can do it true or false, you can make it however you want. It's kind of cool. There are a couple games. I don't know if they'll come up because on the hotel, yeah, it does. So the Jewels of Wisdom would be the one that you would want to play with any of our stuff because it'll give you the name on the jewel and then the definition over here on the stone. You can match them up that way. The Stellar Speller is more for kids who are learning spelling. But it's a fun website, something you could download onto your phone and do while you're sitting at the doctor's office or something. If you wanted to play around with it like that. I am going to send you a Kahoot. It will end 9 a.m. next Friday. So we will know when we get to class who has beaten the Kahoot. If you've never done a Kahoot before, it's basically an online game. Time does matter. So, obviously read through it fully, but, the faster you get it done, the quicker it happens. And then I will send you the readings for next week and the videos, all of that. In fact, I can go ahead and give you the link. Oh, stop it. I miss my mouse. There's the link for next week's readings, but I will put that in the email as well. Questions, comments, concerns, thoughts? And this was a heavy one. It's a lot, but you guys got this.
Okay, I just downloaded the Cram app,
Uh-huh.
and you said to put CADCA in there, and
Yeah.
it'll bring up information. Okay, I'm just looking to find it. I don't see
Yeah.
it yet, but I'll
Yeah,
keep
so
looking.
when you see the search area, I may or may not have played the little jewel one. It's kind of dorky, but hey, we all learn differently, so whatever works for you. All right. So I will see you guys next week. Reach out if you need anything, or if you want